It's Workers' Day all over the world, but the streets outside Baragwanath Hospital, which is the biggest hospital in South Africa, are anything but quiet. Health workers were out protesting. They're feeling vulnerable. They don't have enough protective gear. And we hear there was a skirmish with the police. Our reporters were there catching it all as it unfolded.
My name is Kidwani. We're here at Baragwanath Hospital. They are protesting, the nurses are protesting about the lack of the equipment that is being sponsored to them by the government, and they feel like their needs are not being met because they feel like they're not safe. One of the police just arrested one of their members because they're saying it's for social distancing. Can you?
We are asking that all healthcare frontline staff to be tested for COVID-19. We are aware many of us in private sector as well as public sector have been testing positive, and we only realize that later, only when they start becoming symptomatic. These healthcare providers working in hospitals would naturally be commuting through public transport, which they go in and commute with innocent fellow commuters and have a higher risk of passing on the infection. But also we have this healthcare workers that are not housed nor transported by the facility, that they also go home and have a potential to infect their family members. We know the elderly and the young are most hit by this virus, and one of also our demands is the fact that we want more staff. I mean, it's been said we'll add more staff, we'll give you PPE, but on the ground, when you look around, everybody is having a surgical mask that tears apart, and some of the workers, when they've got N95, are told to go and use that same mask they're supposed to use for 3 hours to use it for longer than 5 or even 7 days. That's how scarce this PPE is. We are actually demanding that healthcare workers in the front line be given risk allowance, should be paid the increase that was due on the 1st of April, and also given a 6 months tax break. We do feel in a times of the pandemic such as this one, there's been a lot of exposure from our from all angles. If you follow the statistics that are out in the public domain, you will see the numbers that are declared. Even today, there was numbers that were put out there to say the rate at which in private sector and government sector the healthcare workers are contracting COVID-19. But more than anything, it tells you that nurses are the most hit, because you can imagine we spend most of the hours of the 12-hour shift that we spend with the patient. And we've complained about training in the past that no one in their curriculum as a nurse or as a doctor had COVID-19 as one of the pathologies that you learn. Now that the pandemic is here, we expected the government to be more robust. It should be continuous development for the healthcare providers, and that's not the case. And we are actually attributing that to actually lack of training, lack of PPE, lack of support, lack of transport. And yes, we are having a lot of numbers of our healthcare providers, but they're also told to be secretive about it and to go hush. And we are saying we might not keep quiet for quite long.